To Bahee, who is a specialist paediatric dietitian and children's nutritionist. Very good to talk to you because those figures will be shocking for many people just to see how critical the situation is right now. Are you in favour of children as young as 12 being offered weight loss drugs?
Well, it's not for the general child who might be a little bit overweight. I believe that at the moment there are some positive effects of taking or giving this medication to a select group of children who are very severely or clinically obese, because of course we know that the longer a child lives with obesity, they can suffer from diabetes, obstructive sleep apnea, bone issues, mental health issues, and so on. So sometimes there may be a benefit in helping them just get started on a weight loss journey so that we can reduce the risk of some of these other health issues.
But Bahee, do we know what the long-term effects of these drugs are on adults, let alone children?
At the moment, we don't have enough information about the long-term effects, and I guess especially in our adolescents, we do need to be very cautious about the use of these medications. But so far, the clinical trials that have been conducted in children don't show any severe side effects, but the majority of them do experience problems like nausea, vomiting, diarrhea. It is still possible to be malnourished, even though you are living with clinical obesity. So that's why it's really, really important that weight loss medications are always offered as part of an MDT setting where there's a dietitian, access to a psychologist, access to a physio, or someone who can prescribe a appropriate exercise and lifestyle program, so that we are addressing lots of these other issues like preserving lean body mass, looking after their bone health, making sure their diet continues to be nutrient rich as well.
You're talking about some of the physical effects as well of obesity, but can you explain a bit more about the bigger picture, the effect that it has on children, not just physically, but emotionally as well?
Yes, I mean, for some children, it's probably, they probably refuse to go to school. They probably feel really depressed. They don't feel great in their body. Maybe they have difficulty sleeping, and they just want to be a regular kid. And so for those children where there is not just living with obesity, they probably have other healthcare or medical problems as well. And so it's really perhaps a tool to get them started on their long-term weight loss journey. But it's so, so important that we're able to support these families to make long-term behavior changes as well, so that they are able to successfully keep the weight off.
Bahee, thank you very much for joining us.